The UNDP Solar for Health Investment Initiative has extended its wings to provide a 450 kilowatt solar unit worth $500,000 to the national pharmaceutical company of Zimbabwe, NRTV. The initiative is aimed at ensuring a reliable and uninterrupted power supply for the national pharmacy's cold chain supply system, whose mandate is to procure, store and distribute medicines and medical supplies to the public health institutions. Dokas Mufiri gives us more.
UNDP, funded by the Global Fund, has expanded its Solar for Health initiative to NRTV following the construction of a 450 kilowatt solar unit sufficient to meet the warehouse power requirements and even feed excess energy back into the national grid. Handing over the project to the Minister of Health and Childcare at the NRTV warehouse in Harare this Thursday, the UNDP resident representative said that the solar system is meant to keep the national pharmaceutical warehouse up and running even in the event of power outages, and at the same time help implement and accelerate the operationalization of the renewable energy policy and strategy.
This is something that we consider to be very, very important in terms of shifting the frontier of development in Zimbabwe. I want to really mention the fact that when it comes to the issue of energy efficiency, this is one of the things that we want to really push for to promote smart health and the health for the climate, particularly when it comes to reducing the reliance on national grid, which allow electricity to be supplied to other sectors of the economy that need them, and also something that leads to making sure the operations of NRTV on health facilities go uninhibited, unimpaired when there are outages. And this is one of the things which we consider to be a major contribution of this particular equipment we're handing over today.
Global Fund, which has already invested $18.7 billion in the Solar for Health initiative, said the investment is not only about health services, but also addresses challenges posed by climate change and frequent electricity blackouts.
Zimbabwe's Solar for Health initiative aligns fully well with the Global Fund strategy, which seeks to address the impact of climate change on the health system. By supporting projects like this one, we are building a stronger health system and also contribute to the global fight against climate change. Our strategy encourages countries to improve healthcare management, develop reverse logistics, strengthen supply chain to increase efficiency and reduce environmental impact, and of course, support solar energy infrastructure as we are doing here today.
In his acceptance speech, the Minister of Health and Childcare, Dr. Douglas Mombeshora, said the contribution comes at a crucial time when power shortages are causing significant challenges to healthcare services in most public health institutions.
Frequent outages disrupt critical operations, delay medical procedures, and compromise the quality of care that we strive to provide. Facilities have faced challenges in maintaining essential services such as laboratory testing, medication storage, and patient monitoring. This has unfortunately led to increased risks for patients and reduced overall effectiveness of our healthcare delivery. With reliable solar energy, our health facilities can maintain continuous operations, ensuring that essential services are available even during power outages.
The Solar for Health collaboration between the Ministry of Health and Childcare and the UNDP started back in 2016, and since then, 1,044 health facilities have been solar-powered, transforming them into self-sufficient entities, particularly in the critical areas such as maternity, laboratory services, pharmacy, and health information systems. The installation will help NRTV save over $150,000 United States dollars annually in electricity costs. Dokas Mufiri, NRTV News.